Hello, welcome to Thursday Zoom. Today is our last day in Module 151. So now we're moving back around to the blue book, and we're going to get into that a little bit. So I'm going to go ahead and share my screen, and we're going to talk about Module 152, and then we're going to stick our toe in Chapter 1 of Module 152. All right, so Module 152, billing and coding procedures. So tomorrow, when it's time to go into 152 and begin completing assignments, you're going to go in My Courses and you're just going to look for billing and coding procedures in My Courses. Okay? This is what your textbook looks like. If you have 2022, if you have 2024, they're all virtually the same thing. They're just their covers are a little bit different. The information is still the same. So don't worry that you have to buy new books. You do not. Now you have two books, you have two textbooks. You're going to have a textbook and then you're going to have a workbook. How do I know it's the workbook? Because right up here in this little red tab, it says workbook. They look a lot alike, so it's easy to miss it, but it does indicate workbook. You're going to need to be using your ICD-10-CM for hospitals, your ICD-10 manual. New students, if you don't have this manual yet, don't worry. It's going to be a little while before we need it. So just try, don't worry about that for right now. And then you're going to be using your 2020, it may be 2024, 2022, 2021, but it's going to be your HCPCS manual. And we're going to only be in that for like a minute, just so you know. We'll mostly be in this book for this module and next module, Brandy? So, all right. This module is 20 days, starting 3/8 and ending 4/19. I want to point out that it's a 20-day module, guys, so we need to stay up on our assignments. Those 20 days go by very, very quickly. We're going to be covering chapter 1 through 7. What, Brandy?
I think it's a 30-day module.
It is a 30-day module. Okay. Look, we're going to fix this right now. No, it's not. Is it?
Yeah.
We're
Yeah.
going to find out. How did I get that messed up, girl? All right, we're going to trust Miss Brandy. It's a 30-day module. I'd rather have more than less. All right, let's try that again. This module is a 30-day module, starting 3/8 and ending 4/19. Well, that does feel like 30 days, Brandy. And we're going to cover chapters 1 through 7. So your chapter 1 is going to be reimbursement, HIPAA, and compliance. Your learning objectives are found on the first page of your chapter. And it says, after completing this chapter, you should be able to do all these things. Well, today we're only going to focus on Objective 1, distinguish among Medicare Parts A, B, C, and D. So the basic structure of Medicare. Medicare program was established in 1965. You're going to need to know it. It's on the NCCT. It's probably going to be on your Chapter 1 exam. You may even have it in assignment. But the Medicare program was established in 1965. The two parts A and B, Part A is hospital insurance. Part B is non-hospital insurance. For example, physician services and medical equipment would be covered under Part B. Part C, Medicare Advantage, healthcare options added later and formally termed Medicare Plus Choice. So the Medicare Part C option is sort of like Vantage. There can even be Cigna, different kinds, and you're going to pay for these sort of like you pay for your regular private insurance. Part D is not dental, it's drugs. Part D pays for drugs. All right, here we go. So Part A is hospital insurance. Part B is non-hospital. And let's get a better list. Doctor visits, outpatient care, home health care, preventative care, durable equipment. Does anybody know what durable equipment is? Give me an example of one piece of durable equipment.
An oxygen
Wheelchair.
machine.
A wheelchair and what else?
An oxygen machine.
An oxygen machine. That's the equipment that's
CPAP.
used for, I'm sorry? I thought
Said a CPAP machine.
okay, yep. Ambulance rides are covered under Part B, and certain medications. Think of it as any care administered by a physician that is deemed medically necessary. So Medicare Part C. Medicare Part C is also known as the Medicare Advantage Organizations, formerly Medicare Plus Choice, and is a set of healthcare options that must cover all the same services Part A and B cover, from which Medicare beneficiaries can choose their healthcare providers. The options available under Part C are an HMO, PPO, PFFS, special needs plan, medical savings account, and an HMO point of service. Now, I know this sounds complicated, but it's not. Part D is prescription drugs. All right, so I gave you guys an example of what a Medicare health insurance card looks like. We call it a red, white, and blue card. And if I didn't make this slide red, you could see a little red trim around the outside. So this is John Smith. Medicare number. When did his coverage start? Part A started here, Part B started here. All right, so what kind of insurance does Mr. Smith have?
Part A and B insurance.
Okay. This is something else you're going to have to ask when you're taking insurance information and for eligibility. Does your facility even accept Medicare? So if your facility doesn't accept Medicare, the patient would either need to go somewhere else or they would need to be a self-pay patient. They would be responsible for all of their charges at the time of the visit. Okay, so what is this? Well, what is Mr. Smith's member ID number?
1EG4
Yes.
TEF.
Yeah, it's going to be this right here. And you're going to need to put this in the system exactly the way it's listed here with the dashes and all, unless your system puts it in automatically. That's something that they'll go over in training. So when did his coverage begin?
March 1st.
March 1st.
2020. Well, this is an old card, right? So if this patient went to the hospital, the doctor's office on 2/29/2020, is he covered?
No.
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 No, he's not. So these are important things to know, right? All right, now we're going to
I have a question. What if he would have a secondary insurance with that one? Would it still be self-pay?
No.
Well, it really depends. I'm going to tell you something that's kind of a rule. If Medicare won't pay, nobody else is going to pay. So if it's a secondary insurance and Medicare said no, we're not, they're out of network. They don't cover the insurance. Then guess what? You're going to have to be self-pay. Isn't that pretty much the general rule, Brandy?
Yeah, it depends on the provider. But 9 times out of 10, the majority of providers accept Medicare because there's too many Medicare patients not to. But yeah, if they didn't have a secondary that provider was in network with, then they would be self-pay.
All right. So automatic coverage under the Social Security. So does anybody know 65 years of age and above are
Medicare.
qualified
Medicare.
for
Medicare.
Medicare.
Part what?
A.
Isn't it B, Brandy?
What kicks in automatically?
Mm-hmm.
I
Is it
think
Part A or Part
it's
B?
B. I
Yeah,
thought it was-
it's B.
but I always get them confused.
You know what? I should have made myself a cheat sheet because, like I
I'm
said,
gonna
I've been
Google
up
it really
since
quick.
2 a.m. Optional
That's right.
coverage under Social Security. So which one of these was optional where you could choose?
Part
C.
C.
Part C, that advantage. It's an advantage to be able to choose, right? So Part C. So which one of these would cover hospice care?
That would be Part
B.
B.
Okay, this is the hardest one. Prescription drug coverage.
Part D.
Part D.
D for drugs,
Part D.
right? So physician visit coverage.
B.
Part
Part
A.
B.
Part B.
It's A that kicks in automatically.
That's what I was going to
know that.
say. That's not, I was sitting here thinking, okay, automatic coverage under
Go ahead and
Social
get the
Security
started.
is Part A,
Mm-hmm.
and that's hospital. And
you
that's
get
for
to
major
pick.
emergencies. I had to really talk to myself. I was like, wait a minute. I was going to say B, but
Yeah.
I get it mixed up. So y'all
Mhm.
don't worry if you're like, I'm getting that a little bit mixed up. We have to double check ourselves too sometimes.
And
I
y'all,
was
that's
putting
why
up
we
my
have cheat
chart.
sheets hanging up in our cubicle. Cheat sheets.
I was pulling up a patient chart to see if it was 65 when it's Medicare, to see what part it was.
All right, so that's all the slides for today. But because we were discussing about Medicare, I wanted to talk to you guys about a problem that I'm having on my billing job right now. So CPT code is a 97151. So I'm going to pull out my manual and I'm just going to read to you guys what a 97151 is. If you have your manual handy and you want to. I should have had this done ahead of time, right?
I don't know how you do all the things that you do as it is, so I'm not saying nothing.
Now you watch. I am not going to be able to find this because it's out of sequence.
Let's see.
Y'all bear with me. I'm sorry. I was not prepared.
What's the code?
Hmm.
What's the
Why
code?
am I doing that?
97151.
Why can't I just Google it, right?
Adaptive behavior assessment.
Adaptive
What it is?
behavior
Nice.
assessment. Now that is when, let's say, we call them learners at my job. We don't call them patients. We call them learners. Child has autism and they need assessment.
ABA therapy.
Right. And ABA therapy. Right. They need therapy for their autism. So along with that comes session times. So for example, a learner is at school and they have an ABA therapist that goes to school and spends 1 hour a day with them. On the next hour, a tech that is ABA goes and spends the next 30 minutes with them. So you have to break it up in time. So the physician goes in for the first hour and she's going to do a 97151, which is an assessment. And they break their times up in units. So for example, say that it's 18 units. I'm not going to do the math. I just want to talk to you guys about the scenario that she uses 18 units of time. Medicare has decided that they're no longer going to allow the physician to use, how many units did I say?
18.
18?
18.
They're only going to allow them to use 8.
Mm.
But my physicians don't even accept Medicare. But guess what? Blue Cross Blue Shield, Cigna, Aetna, Medicaid Florida, Blue Cross Blue Shield Arizona, all of them have gotten word that that Medicare is no longer going to pay for more than 8 units for a 97151 in one day. Guess
So
what?
now they don't want to pay it either.
So now, all the way across the board, and the reason I want you guys to take special care to kind of understand Medicare is because Medicare sets the rules for insurance for the nation. They are the most strict. So if you learn Medicare rules and Medicare guidelines, you're going to be able to navigate any other third-party payer. Go ahead, Miss Brandy.
And to add on to that, if you're a Medicare billing specialist, that's money. That's special stuff. You're very valuable in your office if you understand Medicare and can bill it and fix claims and get them paid through Medicare. That you're an asset to your office.
But so for me, I get the rejection saying, we're sorry, we're only going to pay for 8 units. And then you tell your provider and they're like, but I was always before getting paid for the 18. Why? So you have to find proof, right? So I was able to go find the documentation where, well, first of all, I have the denial that says no longer going to pay more than 8 units per Medicare MUE. And we're not going to even go into what all that stands for. But my provider's like, no, I did 18 units. I want my 18 units. So you have to send your provider the denial that the insurance sent you and the Medicare rules that denial is referring to. So this job is going to require some research skills. So I want you guys to get on and research. If there's something that you don't understand, like we're moving into coding or reimbursement, or you want to know a little bit more about billing, YouTube is your friend. Y'all, I love myself from some YouTube. There are things sometimes when I'm doing my billing job that I don't quite understand. Sorry, my little tray just fell over that has my calendar that I don't quite understand because billing and coding is ever changing. One thing may work one way one day and another way another day, and you have to be able to solve the problem. So being able to get on and research and look for the answer before you go ask for someone to help you is going to be important because this is a profession. This isn't just a job. This is a profession. And so they're expecting for you to do your own legwork. So I want you guys, you can come to me anytime. You can come to Miss Brandy anytime and ask questions. But I want to encourage you to research it on your own first and sharpen that skill, that problem-solving skill, because billing and coding is a big puzzle. You have your appointment and procedure. Then over here, you're going to have your billing. Then over here, you're going to have your claims process. Then over here, it all fits together. And at the end, once your claim gets paid, the puzzle is all together. But sometimes it takes you trying a couple of puzzle pieces before they actually fit. Have you ever put together a puzzle? And you're like, man, that looks like it fits, but it just doesn't quite. Billing and coding can be like that sometimes. So you've got to be able to be patient. And listen, I'm talking to myself. I am a rusher. I get in trouble, y'all. I'm 52 years old and I still get in trouble from my boss because I'm rushing through something and I'm not accurate and I am not proficient. I need to slow down. So slow down, use your critical thinking skills, and then begin your own research. Any questions? Miss Lindsay, I see that you're here.
Yes, ma'am. I just logged on. I'm sorry.
No, you're good. Oh,
We
this is Lindsay student, not Lindsay instructor, right?
Yes, I'm Lindsay's student. Sorry, we just got back from vacation, so I'm like, oh my God, let me log in.
No, you're good, Lindsay. I thought maybe you were Miss Lindsay instructor. We have a new instructor and her name is Lindsay. And so I wanted to make sure if the instructor was on. And I thought that's weird because she's having her Zoom at the same time. So,
Oh no, I'm in Miss Brandy's class.
well, welcome, welcome.
Thank you.
All right, so this is the part of class where I want to open it up and I want to talk about anything that you find interesting, that you have questions about, that you've kind of been thinking. If you want to know how the day-to-day operations work, this is a time for you to ask us questions about the real world of your career.
While they're thinking about questions, can I throw something out there just to
Sure.
add on to what you were saying? For my newer students who we haven't talked a lot about coding yet, I have a lot of new students. And do not, like Miss Marsha was saying about it being ever changing and one thing working one day and not another, that is so accurate. And that's why we do not memorize codes. That is not
No.
something you'll ever need to worry about. Do not worry about having to memorize codes because they may change from time to time. So, we teach you how to use the manuals. We do not teach y'all how to memorize codes. That's not a thing. So don't stress about that, okay?
No, you don't have to do any memorizing. We're going to show you how to get where you need to go. And I'm even going to go a little bit further. For those of you who have not coded yet, what we're going to teach you is the hard way.
Mm-hmm.
The schooling is much harder than the job because everything is electronic now. Everything is electronic. Like you don't have to really use your manuals. Brandy and I probably, how many years ago was that now, Brandy?
10.
10 years ago, we were still having to pull our manuals down out of our little thing up above the desk and look things up. It's not like that anymore. Everything is electronically coded, or the physician gives the code. You don't have to, what we call cold coded.
Most of the time you're given a super bill and somebody in the office has already written what codes the physician wants to use on there. And all we're doing is verifying, adding a modifier if it needs it, something like that, and filing. So you may never even use the manual after you get out of school.
Right. So we want you to know how to use it, but you do not need to be an expert. Yes, Amanda.
So, question for Miss Brandy. Adding those onto it, will we have to do it ourselves or can the computer do it?
It depends on how they have their software set up.
I can actually give you an example of the software that I use in my billing job. Totally different, Brandy. I can remember, y'all, when we used to bill, we hand keyed everything. Date, place of service, CPT code, modifiers. We hand keyed that. Now it's not like that. What I do now, it's not like that. I go into my billing platform, I pull up my date range, I click into the billing tab, and it gives me everything, every appointment that they're ready to bill. Anything that's good to go is green, and anything that is not is orange. So you unclick the green and you click the orange, and then you hover over the little orange box and it says missing place of service, missing modifier, missing this, missing that. So the world has, yeah, Brandy, put your head down. Yeah. The world of billing has changed. It's gotten so much easier. Again, it's about slowing down, double checking. Do you think that as a biller on the outside of I'm not working in a clinic, I am with a billing company. Can I go in and decide what place of service that provider did that procedure? I am not. Can I just decide whatever modifier I want to put on that? Not now. No. Brandy, can you remember? That's all we did. We amended everything. And the doctors were like, we don't want to see nothing. Just make it right and fix it. It's not like that anymore.
Fix it and get me paid.
Right. So things are so different. It's electronic. It's all just very easily accessible for you. The one thing that I don't have access to that I miss are medical records. When me and Miss Brandy worked together and we billed and we got a denial and they said, hey, we're not going to pay this unless you send us the medical records. I could pop on Rapides Regional Medical Center site, get in, pull the medical records I needed for that patient, send them over, be done with it. Doesn't always work that way. That's my one hurdle. I sure wish I could get medical records in this system, but we can't do that. But remember that you don't have to be an expert at coding, at billing, at any of it. You're going to be trained on the job for so much of this. So don't be nervous as you're going into coding if you're new at it. Those of you who are, we're going to call you OGs, you're not going to have any problem with what little bit of coding that you have left. So, any questions?
I'm just nervous about the insurance and go and take the test because I haven't been able to get on to the Tuesday meetings.
Right, but we have the recordings up.
Okay,
Does Miss Danielle have the recordings up? Yeah, that, and I'm going to encourage you to join the NCCT site, ncct.inc, and purchase the practice.
And
okay, because I'm in it. It's just, I don't know, like, if I'm supposed to put in MA or medical billing and coding or what.
Now, Amanda, when you graduate, are you going to be an MA or are you going to be a medical billing and coding specialist?
Medical billing and coding.
Right. So that's what you go for. Don't do the MA because it's going to bring you a route that study material you can't use. Because we're not going to give injections or take blood pressures and blood sugars and all of that stuff. So.
And also, I'm going to suggest, Amanda, if you're close to finishing the program, as you're clicking in and watching those videos, create yourself a playlist on YouTube so that you can go back and watch them a little bit closer to the time that you take your exam.
Right.
And that means if you finish your program and then you don't have access to Moodle or something like that, you won't be able to get back to those links. That's why I suggest make yourself a YouTube playlist of NCCT prep videos, classes you found particularly useful, any other billing and coding stuff that you find on the internet. Make yourself one playlist and have all that on there.
Okay, thanks.
All right. Anything else, guys? Quick and painless, right? If you haven't done your final exam, except for new students, if you're a new student and you're on here, please don't worry about any final tests. But final tests are today. Go in and get those done. Finish up any lagging assignments because guys, just like you, some of you clock in and out and have a job, right? This is our job and we have a deadline for grades. So get your stuff done and reach out to your instructors before 4 o'clock tomorrow so that over the weekend, we don't have to come back to our computers. So if you have anything that you need reopened, again, you must ask your individual instructor. We all have our different rules. And if it needs to be reopened by 4 o'clock tomorrow, you need to ask. So get in and look at those grades, figure out what you need to do to get caught up. All right, you guys have a wonderful evening.
Miss Brandy, can you stay on?
Alicia, it'll click off, Brandy.
Oh, that's right.
It's gonna click off because I'm the host.
I can take over the host. Or wait, you need to stop it.